Hi, everybody, and welcome back. We are going to start talking about development for birth and the newborn infant. So, the first thing we need to learn is the term for all newborns, and that is a neonate, is how we refer to newborn babies, which should make sense if you've ever heard of the neonatal unit. That is where newborns are housed after they arrive in the world. Upon birth, immediately upon birth, within minutes after a mother gives birth, all neonates are going to be given what we call the APGAR test. And the APGAR test is actually it's a scale that is supposed to be an immediate indicator of the neonate's health as soon as it enters the world. So there are 5 categories that the neonate gets evaluated on, and we take all of those categories. They get a score. Each category gets a score between 0 and 2, and we add up each score in the 5 categories. It's a scale of 10 points. Okay. um, the higher the score, the closer to 10, the healthier the baby, the more functional the baby's health is, right? So we always want to score high on the APGAR if we can. So those areas are appearance and color, okay? Looking for a proper healthy appearance and color. We don't want baby to be blue because that means, okay, you're not getting enough oxygen, right? That's going to score lower on the APGAR. We're going to look at pulse and heart rate. Should they, are they demonstrating a healthy pulse and heart rate? We look at grimace, which means reflex and irritability, right? Are they responding to the environment? Are they having this awareness that, I'm out of the womb? Are they, responding? What's their activity? What's their muscle tone, right? Do they have proper muscle tone? And finally, what's their respiration like, right? What's their respiration effort? Is it labored? Is it fine, or is it haggard? This combination of performances on these all act as an overall proxy score for the health of the baby. Each category is equally important, and that APGAR scale is a measurement of all 5 categories put together, and all 5 categories indicate the overall health of the neonate. Okay. Like I said, you want to get as high to 10, as close to 10 as possible. Most children score somewhere between 7 and above. Okay. Neonates who score under 4 typically need life-saving attention, life-saving medical intervention. Okay. However, it's also important to keep in mind that if the score on the APGAR is above a 4 but not above a 7, it can go up very quickly in moments after, within the next hour of the child's life. Okay, it's not necessarily a hard score like this is where they're going to stay. For example, my son when he was born, his APGAR was somewhere between a 5 and a 6, which was distressing. But he was also born early. He was born premature, and within an hour, those APGAR scores were right up there. Right, so it doesn't necessarily mean oh my goodness. The oh my goodness comes when it's under 4. Okay, things that we want to look out for with a neonate is going to be things like anoxia, which is going to be that lack of oxygen to the brain. This can happen for a myriad of reasons during the birthing process. And more than a few minutes of anoxia can result in developmental delays, such as things like cognitive disabilities or lack of speech development. The reason we're looking for things like anoxia and we're looking at those measures on the APGAR scale is because that early it helps us to identify those early immediate needs and issues that the APGAR is screening for, so that we can get instant intervention to the neonate. As with most illnesses, the earlier and the faster we can get intervention and treatment, the better off the neonate will do. Okay, so we want to get those measures immediately upon entering the world. Surprise, newborns are fuzzy. Okay, so this is important to know. Don't freak out on your first pregnancy or the first time you give birth. This is called lanugo. Okay, and this is the light fuzzy hair, and they're sort of covered in it head to toe. It can be a little bit more prominent in some babies than others, but you don't need to worry if it's really prominent, because it falls out not long after birth. Within a short period of time. Okay, but it's just an element that sometimes freaks people out. But once the baby is born, that bonding between baby and parent needs to happen immediately. There should not be downtime, or there should be minimal downtime between the removal of the baby and doctors doing things. Like if there's no immediate emergency or medical intervention that needs to happen, they should be getting that baby into the arms of mom and dad as soon as possible. We want skin to skin contact as soon as possible, because this is where bonding and attachments begin to develop between parents, in particular mom and baby. Okay, babies need physical touch. It's because that physical touch actually stimulates the release of chemicals, and that release of chemicals actually starts stimulating their growth and development. It also begins to develop the emotional attachment. So it's really important that we get that bonding process started as soon as possible. And more hospitals are moving to become There's a specific categorization that they can achieve if everybody that gives birth gets that skin to skin contact with baby within, a certain period of time after giving birth, within, something like 20 minutes. And then they require anybody who holds the baby within the first 24 hours, it must be skin to skin. That's mom, that's dad. If grandma and grandpa want to hold them, you can take your shirt off, or you can, it's strangely as it sounds, you can put the baby up your shirt, right? But they want the baby against your skin, feeling your skin. Because remember, they just left the inside of the womb. This whole new world is loud, it's bright, it's scary, it's foreign, and we want them to feel safe and start bonding and releasing those chemicals for growth and development. Preterm infants are babies that are going to be born prior to 38 weeks of gestation. Preterm babies are at much higher risk of illness and infant death. Again, I want to caution you, though, to not panic too much, that there are plenty of babies that are born preterm. They tend to have lower birth rates, which is a risk factor for illness and development. But a lot of those babies just bounce right back. They do really well. And my son is one of them. My son was born about 3.5 weeks early. He was born at 5.6 ounces. Shortly after birth, baby's weight always drops because remember, while he's in utero, he's being sourced constantly by your body. Then when he or she is out of the body, they are no longer sourced. They have to learn to eat externally, and their weight drops a little bit. So he went from 5.6 ounces to 5.3 ounces, which is a tiny baby, right? 3.5 weeks early. But by the time he was, I think, 7 weeks old, I mean, his weight was right where it needed to be, right? So don't freak out too much, especially if the preterm is not terribly preterm. If they're fed well, if they're properly taken care of, their body weight gets right where it needs to be. Okay, and of course they're healthy and so forth. But certainly we do have concerns with preterm infants. Okay, we also have concerns with post-mature infants, and post-mature infants are going to be neonates who are in the womb notably longer than the expected due date. And I'm not talking by a few days or so forth. I'm talking by multiple weeks. Okay, there are risks when the baby gets too large in the womb. The placenta may not be able to support the amount of oxygen that they need in order, to meet the needs of the size of that child, which could result in anoxia and ultimately brain damage. And typically what we do then is, they induce labor, because the baby's getting too big and there's just too much stress. There's too much physical stress on the placenta, on the baby. We need to get the baby out. Okay. So we just induce labor. Birth weight is a strong predictor of neonate health. The average newborn weighs about 7.5 pounds. Any neonate at or below 5.5 pounds is considered low birth rate, and that is a statistical correlate. It is strongly related to neonates having more health problems and more developmental shortcomings and issues. Okay. Very low birth rate infants are going to be infants who weigh anything at or less than 2.5 pounds. Now, when I say that, a 2.5 pound baby is just disturbingly small. Okay. And we're talking that would be a very, very preterm delivery, right? A very preterm delivery. And the problem there is that they, 2.5 pounds, or they have only been in the womb less than 30 weeks. Okay. When they're in the womb less than 30 weeks, there's a very low chance of survival. Primarily because in neonatal development is when all of the internal organs are growing and developing. And when we have that preterm birth, less than 30 weeks, the internal organs are just not developed enough or strong enough to sustain a child outside of the womb. In particular, the lungs. They can't breathe on their own because the lungs are some of the last internal organs to develop in the womb. Okay. Small for gestational age infants are going to be neonates below the weight that they should be at their due date. This could be due to things like poor nutrition and poor nutritional intake during pregnancy. Teenage mothers or mothers with husbands who are older and mothers who are carrying multiple babies are more likely to have lower birth rates in their children, or excuse me, birth weights, not birth rates, lower birth weights in their children. But largely, as long as the neonate wasn't born too early, the primary fix to most of these situations is simply weight gain and growth. It's simply weight gain and growth, right? So that's an easy fix. That's an easy solution. Again, we get concerned when they're born too early because, even weight gain, it can't speed up the development of those organs to be able to, properly function to support the baby. But a lot of these preterm babies or underweight babies, they can catch up really quickly, right? They can catch up really quick. Like I said, lungs are developing in that final month of gestation, and premature babies can struggle with breathing and oxygen retention, which can result in death. It also increases your SIDS risk, your sudden infant death syndrome risk. Um, so these are all things that we want to keep in consideration. We want to get as much proper nutrition into mom, and we want her to carry as close to that due date as possible, but not too much over it. Okay. Premature infants are often overstimulated by sights and sounds, and they have trouble moving fluidly at first. You'll see that, neonates and early babies have like some herky jerky hand movements, or like they do like a lot of that. And that's pretty typical, right? But most premature infants eventually catch up in development and they hit those normal milestones. Okay. Babies who are delivered vaginally through natural birth have better health starts than do babies delivered via cesarean. Cesareans are done for a multitude of reasons. Okay. If babies breach, if mom's having distress during the labor, if baby's having distress, their heart is having distress, or their respiration's having distress, they introduce a C-section in an emergency circumstance to get that baby out and out of stress. And again, it happens. C-sections are fairly common. It's not ideal, right? It's not something you want to do. I had a C-section. You know, it's not the end of the world, right? It's not the end of the world. So don't freak out if you have to have one, or if you know somebody who has to have one. It's just we would prefer to give birth the natural way. Okay, because it is healthier for the baby. Infant mortality is when death occurs within the first year of life. Infant mortality in the United States is actually really, really good. And it's certainly, when we compare to what it was 100 years ago, we're doing great, right? We have gotten it down to 6 deaths per every 1,000 deaths. 1,000 births that occur. Okay. And this is a rate that has been steadily declining over many decades, and it continues to go down. So that's a really good thing. Stillbirths are unfortunate situations where the baby dies within the womb and has to be delivered nonetheless, because they were that far along in development, and they are in fact delivered deceased. Okay. This happens typically in about 1 in every 100 births. The death, this can happen prior to birth. This can also happen during birth, that you did carry the baby to full term. The baby at the beginning of labor was alive, but something happened during the process of labor, and unfortunately the baby passed. Okay. And that is considered a stillbirth. Have to touch on 2 things here, and the first is going to be postpartum depression. Just going to define that. That is, intense feelings of sadness and depression that occur after giving birth. Please note that all women, after they give birth, get at least what we call the blues. You have to remember that your body rapidly goes from being a pregnant body to a non-pregnant body. In addition, it goes from pregnant to non-pregnant to breastfeeding, which means that your body is just like, it's in incredible hormonal upheaval, right? I mean, there's just a multitude of hormonal revolutions going on internally, which is all very natural and is all very healthy, but it can take a toll on emotions, and it's very common for women to get the blues, to be very emotional, to be very teary, to cry easily postpartum. We call that the blues. We wouldn't necessarily call that postpartum depression. Okay, postpartum depression is when we're going beyond the blues, right? When you're having panic attacks, when you're having extraordinary depression, you're not just teary, but you are having serious depressive issues, all the way to the point that you're not responding to the baby's needs, you're not responding to your own self-care needs. This should not last beyond 2 weeks. Okay, 2 weeks is about the normal period of time that it takes for the hormones to shift. And if we're seeing the behavioral and emotional impacts last beyond 2 weeks, then we've got a noteworthy problem, and mom needs to get back in for care. Okay, she needs to get back in to get that postpartum treated with antidepressants and other interventions. Because if it's not treated, postpartum depression can last for months. In fact, there are cases where it has lasted for years. New moms need a lot of support, okay, especially if you're a brand new mom and you've never had kids before. It is definitely getting thrown into the deep end while you're at your most hormonally unstable that you're ever going to be. In addition to all of that, you're also incredibly sleep deprived, which exacerbates all of those circumstances, especially the depression issues. So new moms need help, they need support, they need rest. Make sure you sleep when the baby sleeps, because if you don't, it will exacerbate these symptoms. It's okay to let the house be a shambles. In fact, get used to it. Let that go. Don't think, oh, the baby's sleeping, I can clean the kitchen. No, think the baby's sleeping, I need to sleep. Right? Because if you're not in good shape and you're not taking care of you, you're not able to take care of baby. And finally, I want to talk about postpartum psychosis, which is very rare. but it does happen. Postpartum depression is really a spectrum with the blues down here at the lower end, and then as we go down that spectrum, we get more serious. We get full blown postpartum depression, and all the way at the opposite end of that spectrum, we have postpartum psychosis. Okay, this can occur years after giving birth. It can maintain for a very long period of time. Okay, depression will have been present, but it spirals into psychosis. And what that is it's a psychotic break with reality. You are having a hard time distinguishing, or you are unable to distinguish between what is real and what is not. And this is unfortunately when we see mothers doing themselves harm, engaging in self harm or suicide, and very tragically when they murder their own children or they kill their own babies. Okay, so certainly the minute postpartum symptoms set in, we want to treat it immediately so that it never slides down that spectrum. It's very rare, like I said, when it does, but we want to stop it before it ever gets there, even in those rare instances.